Okay, this is a quick look at the spinal nerve and the spinal cord in place relative to the vertebral column using zygote body. So what you can see here is kind of a somewhat a slightly lateral dorsal view of the vertebrae, thoracic vertebrae, with the ribs coming off. You can see the articulation of the costal tubercle with the transverse process of the vertebrae, and you also have those spinal nerves, segmental spinal nerves or thoracic nerves in the thoracic region coming off, running along the subcostal groove. So a really nice view of that, each segmental nerve coming off underneath its respective rib, of course on both sides. Easier to see on the left side here. Remember, we're looking down dorsally. There's the vertebra, its spinous process, transverse process sticking out on each of those thoracic vertebrae. Now, what's really nice is we can now start to remove some things. So let's take a look at what happens if we get rid of this vertebral arch. And now you can see the spinal cord behind there with the roots of the spinal nerve coming off. If we get rid of another one, now we can see the next spinal nerve coming off of the spinal cord itself. Remember that we can also take a look at the, just to show you, okay, now we can see the spinal cord there wrapped in the dura mater. Remember, we've removed the thoracic vertebrae and we're looking down on the spinal cord from a dorsal, somewhat lateral position. And this white material here is the dura mater wrapping around the spinal cord and the roots of the spinal nerve, which we saw previously, those roots exposed. They look like that. And now you can really nicely see those roots of each spinal nerve. And if we zoom in even closer and rotate this slightly, we can see a dorsal rootlets coming off there. Remember, those are going to be all the sensory neurons, and ventral rootlets coming off there. And we're going to zoom in a little bit closer. And now if you can really see where the dorsal roots are coming off here, the sensory neurons joining the spinal nerve, the motor neurons coming off the ventral horn of the spinal cord coming together and joining what is then a common spinal nerve that has both dorsal and sensory components. It wraps under the underside of the rib, and then of course the dorsal sensory neurons would be coming off to the skin overlying this region, whereas the ventral components would be going into the muscles. And if I zoom in just a little bit further and get the angle right, there you can see how the dorsal root has that little bit of a swelling on it, that dorsal root ganglion, where all of the cell bodies for the sensory neurons are located, and then the axons just project right into the spinal cord, as compared to the ventral root, which just continues right out into the spinal nerve. Now, if we zoom out and flip this around quite a bit, zoom out, and we can now see all of those spinal nerves coming around the full extent all the way around the body, underside each rib in that subcostal groove, going to every part of the body. As we zoom out even further, the other thing I'd like you to notice is that in the cervical region up here, you can see that the cervical nerves contribute to they would have branches that come around to the neck, but also contribute to what's going down the upper limb on either side, the nerves of the limb, which we'll be taking a look at later. And then down in the lumbar region, you can see that some of the lumbar nerves, and then especially the sacral nerves, contribute to the nerves that go down. In the case of the sacral nerves, they go on the back of the leg, the femoral plexus or femoral spinal nerves contributing to the nerve that come down the front or the anterior aspect of the leg. And so if I zip back this way, now you can see those sacral nerves coming out through what's called the sciatic notch and down the back of the nerve. Again, we'll see that when we do the lower limb, but nice to see a little bit of it right now. Finally, from a ventral position, I'm going to just zoom right into the thoracic and lumbar region in the abdominal cavity. All the organs have been removed, and we're at the back of the body wall behind what would be the parietal peritoneum, and that's where you can really nicely see this sympathetic chain coming up from the lumbar nerves, getting fed from each spinal nerve. But this, remember, is part of that autonomic sympathetic component of the autonomic nervous system that contributes to these splanchnic nerves that come to all the organs, the fight or flight response. You can see it on this side, and you can see it on the left side as well. Right side and left side. And if we follow it on up into the thoracic, all the way up into the thoracic cavity. So if I zoom in here into the thoracic cavity, there you can see the continuation of that sympathetic chain or that sympathetic trunk. It has the little ganglia associated with each segment, and they all come together and form these splanchnic nerves, that then go out to the organs. We can also see although the parasympathetic components of the vagus nerve coming down from the neck region and going through, or even coming all the way off the brain and going down through the neck into all of the organs. Hard to see that all that successfully in this view. There's the continuation of that vagus nerve that would be also going out to all the organs, kind of suspended in space in the abdominal cavity there, in that region there. So just to review and remind you, we've got the sympathetic trunk on either side of the vertebral bodies, and when we come back to that's from the ventral side. When we zoom out, we can see thoracic, lumbar, and sacral spinal nerves contributing to the nerves going down to the lower limb in the case of the lumbar and sacral, the upper limb in the case of the cervicals. And in this dorsal view, we can really nicely see the spinal cord. We can see the spinal nerves coming off of between adjacent vertebrae, and if we get rid of those vertebrae, we can see the spinal cord wrapped in its meninges. If we can eliminate the meninges, now we can see the dorsal and ventral roots, zooming in even closer, dorsal and ventral roots of each spinal nerve running into that subcostal groove on the underside of each rib all the way around the body cavity. So that's a quick look at the relationship between the spinal cord and the vertebrae and the spinal nerves coming off, and also the sympathetic trunk on the anterior or ventral aspect or lateral aspect of the bodies of the vertebrae.